Hi, uh, my name is Kapil Shastri, and I have created a project for this Agents Assemble Prompt Opinion Healthcare AI Endgame Challenge. So my project is called Atlas, and it is an autonomous transition and longitudinal agent system. So first, I'll tell you the architecture and the principle about my project, and I'll describe you what it is, what I have built. So here on the BYO agent and on orchestrator agents, I have this project, and it has to in total this A2A agent has in total six agents that work simultaneously. As you can see, Atlas Clinical Handoff, Meditation Safety, Prior Authorization, Patient Navigator, LTOH Screener, and Loop Closer. So now I'll tell you the pitch of my project. So every year, 2.3 million patients are harmed at the hospital discharge, not because anyone failed, but because coordinating a safe discharge requires six complex workflow happening simultaneously. And today, every single one of these tasks that I described, which is being performed by this agent here, is in today in hospital. It is done by six total different departments that might or might not communicate with each other, and this makes the discharge very difficult. So even if a patient is being discharged from a hospital, getting into another hospital is a quite task, and my project at last can do it autonomously with least human intervention, like with just prompts. And this in total, this problem causes $26 billion of loss every year and thousands of lives annually. So let me tell you what Atlas does. So Atlas is a six-agent system. It is an orchestrator. All the six agents are deployed on the MCP servers, as you can see here. And now let me tell you how our project will work. So I click here Launchpad. I click here Atlas Care Transition Orchestrator. This is our main project, and I'll write the prompt here. So as of now, I have copied the prompt already. And what this prompt is, let me explain you again. So as you can see, this is a prompt of a sample data of a patient. Patient is Maria Garcia. She's 68-old female, diagnosed with heart failure with reduced ejection fraction, and she has type 2 diabetes and chronic kidney disease stage 3. These are her current medications, her discharge designation, home with home health, and her provider was a cardiologist. Her preferred language is English, and this is her history and everything. So now we have given this prompt. So for example, see it this way, that a patient is being discharged from the hospital after a series of maybe operations or maybe treatment by the provider, by the healthcare provider. Now I am at a discharge desk, and I have to write the final discharge of this patient, and I want to have all the important details included. So even if she is willingly to visit another doctor, maybe in another facility or maybe again to our same facility, then they can have all the prior information about the patient. So now I click enter, and now you see it is responding. So what is being happening is this whole system with proper prompting and system script has been forwarded to chat gpt, and the response is being generated here. So we'll wait for a response. So now the tool is being called, and it is completing the process of complete discharge of the patient, and we are just waiting for the results, actually, nothing more. So let me narrate it through. Now what we are doing is we are watching the orchestrator. It is delegating the Atlas discharge agent via A to A, agent to agent conversation. So now this is the complete form that has been uh, sent to our agent via this orchestrator agent from prompt opinion, and it is generating the result. Oh shit! It has hit the quota limit because obviously I have been using it frequently. But for an example, let me show you the results. So this, if I would have sent this, and if the Chat GPT's limit would not have exceeded, then this is the result that would have been generated. So as you can see, it has completed the discharge process for Maria. This is the clinical handoff to the cardiologist. It has generated the report that the patient primary diagnosed with heart failure and reduced. These are her conditions, the volume status, and optimized with. She is being discharged home with home health services for ongoing monitoring. Questions for follow-up. It has, as you can see, it has generated questions for follow-ups. This is her medication reconciliation. These are the medicines that she's been taking, and also the reason why these medicines are being suggested for her. Then prior authorization and insurance jurisdiction. The patient discharge instructions like welcome home, Marsha, you are ready to go home, and your medication, your health, and warning slides. Call your doctor right away if you have like trouble breathing or new chest pain, dizziness, or bad headache or sudden breathing that won't stop. Next schedule your appointment with cardiologist in 1 week. So now this can be scaled to further more extent, like maybe a calendar can be scheduled automatically for a visit with a cardiologist. This is a social determinant screening, like patient lack personal transportation. So now you can see the patient lacks personal transportation. So this can be scheduled to where AI can call an ambulance or maybe a service that can drop her home safely. Her financial status and everything can be taken care of. Maybe we can integrate the insurance company and their services to this agent. So maybe while she is being discharged, all the procedure for the insurance could be completed right away from here. And the last is 64-hour loop closure. So it has created a task ID to follow up on the checkup due and everything. So this is what I have created, and I think this is a good start, and I can see the potential of this to grow further. Like this can be integrated with the all the system and all the procedure of the hospital, and we can have a complete autonomous system where the discharge of safe discharge, not a normal discharge, a safe discharge of the patient can be met without any human intervention. So please do have a look of it and let me know.